Good evening, everyone. Welcome to you all. My own name is Paula, and along with Dr. Rickard, we want to thank you for being here and joining our webinar. It's our pleasure to have you with us. Tonight, we're going to be talking about recognizing early signs of autism. We hope this is going to be a really informative and helpful session for you all. So, just to begin, for those of you who may not be familiar with Constellation Healthcare, we're a highly experienced specialist provider of neurodevelopment assessment and interventions to children and adolescents throughout Ireland. As well as being an appointed provider of assessment and need on behalf of the HSE for a number of years, we also provide private autism assessments so families may book us directly. Through our work, we support thousands of families annually with our expert multidisciplinary team. We pride ourselves on providing a child-centered approach to our autism assessments, which are grounded in best practice clinical standards. Our reports are clear, comprehensive, and recognised by the HSE, providing families with clarity and the confidence they need to move forward. We're going to cover quite a bit this evening. We understand that navigating the early signs of autism can feel overwhelming, and we have a lot to get through over the next 45 minutes. We'll get started in just a minute, so we really want to maximise our time with you. Before we begin, I want to let you know that Dr. Rickard has interwoven many of your pre-submitted questions into tonight's content. We hope to have some time at the end to answer any additional questions that you may have. Please feel free to drop them into the chat, or if you prefer, email me directly. I'll drop my email into the chat in just a second, and we'll follow up later this week. Now, it's my pleasure to introduce our speaker, Dr. Eóin Rickard. Eóin is a highly experienced clinical psychologist and principal psychologist at Constellation Healthcare. We're delighted to have his time this evening. Without further ado, I'll hand you over to Eóin.
Thank you so much to everyone for joining us this evening and taking the time out of your evening to share it with us. So hopefully you'll find it practical and hopefully helpful in terms of understanding a bit more about autism and again early signs. And when I say early signs, I don't just mean in terms of early childhood, but all through childhood and adolescence as well. So when kind of people are starting to tune into the signs of autism. So there's a lot more in this topic than we could hope to cover in one session. So I'll try and focus in on some key aspects and some kind of key points that I think will be helpful. And it's something that I may not get to absolutely everything. So if you have a specific question in mind, as Paula says, if you pop it into the chat and we'll try and follow up afterwards. And I won't respond to kind of questions as we go through. So we'll come to that at the end. But it's something that hopefully again I'll be getting to the points that you'd be interested in again trying to focus on the things that come up, the queries that come up most often. So um first of all, I just talk a little bit around the background to autism. So again, I'm sure people will have at least some degree of background or understanding around it, but autism, the very basic kind of sense, is a neurodevelopmental condition, and that means differences in brain development or differences in how a person's brain develops. So it's understood in the wider context of neurodiversity and neurodivergence, and our understanding and our awareness has really, really evolved quite significantly, particularly in the past 10 years. It's something that one of the points that I'll try and get across, and hopefully will come across as we're talking through the science later on, is that there's a huge amount of variation in relation to autism. So sometimes people will have a specific idea in mind or a specific thing or a specific kind of set of characteristics that might be associated with autism, but really there's a huge degree of variation. And again, going from very subtle to very overt. So we'll talk a little bit about that in more detail. The areas that we think about when we're thinking about autism are social communication, which is things like eye contact, tone of voice, it's gestures, facial expressions, those kind of things. Social interaction, which are things like social cues, social understanding, social roles, that side of things. And then what we call, but again, it's kind of formal terms, restricted or repetitive behaviors. That's really kind of patterns of behaviors, patterns of interest. And that includes a lot of different things. So things like a person's sensory profile, a person's like child's play interests, again, areas of interest when a person is older. It also covers things like maybe kind of rituals, if that's something that's calming for someone or soothing for someone. And just to kind of give a bit, talking a bit about terminology again, the kind of formal term, as we have laid out in the kind of formal diagnostic manuals that we use as psychologists when we're doing an assessment for autism would be autism spectrum disorder or autism spectrum condition. And you might see that in formal reports, but generally when we're talking about it, we would just use autism. That's kind of the more common kind of thing we'd say. And just also to say that along with kind of our understanding developing and again evolving over the years, it's the case that a number of kind of different categories that used to be used for autism were kind of folded together. So again, you might be familiar with the term Asperger's syndrome, which would have been its own kind of separate diagnosis, but was still under the kind of broader umbrella of autism. But that's now just understood as autism. So talking and thinking a little bit about assessment for autism, and I'll just give you a little bit of background. It's something where, as a psychologist, you're really trying to, with an assessment, build up a kind of comprehensive picture of a child or a picture of a person. You're really trying to understand about their early development, about their kind of progress over time, and you're trying to get again as complete a picture across different settings as possible. So you're going to be using interviews, you're going to be using questionnaires, trying to build up that picture. We also use formal assessment tools, and I'll talk about those in a moment, the kind of ones that you'd expect to see in Ireland in particular, because it varies across different countries. But there are a couple that would be quite well regarded and quite widely used that I'll talk about now in a moment. You're also looking at your kind of observations of the person, so how the child might communicate, interact, play, and how they respond to their environment. And you're also looking, I suppose, with an assessment, you're not just looking at is it the case that the person is autistic or not. You're looking at what other kind of things might potentially explain or help us understand the person. So you're looking at the possibility, in some cases, in relation to what's called global developmental delay or intellectual disability. You might be looking at things like ADHD, adjustment to kind of life circumstances. You might be looking at things like anxiety. DCD is also known as dyspraxia, and then language needs as well. So you're really trying to kind of start as broad as you can and narrow down and try and build up that understanding of the person. And it's important to say with any assessment, it's kind of a snapshot of a person or a child in time. It's something where you're trying to get as good a sense of the person as you can in the time that you have during the assessment. So just in terms of what kind of things we might use those kind of formal assessment tools, and the reason we use these tools to support an assessment is it allows for kind of consistency across different psychologists. It allows for a bit of consistency in how we approach the assessment. And as I say, behavioral observation is part of it, and kind of getting to know the person, interact with them, and interact with the child. And so the ADOS2 is what we would use for that. For younger kids, that's a little bit more play based. It's a bit more trying to create opportunities really to interact and see how the child communicates, what kind of their play interests are, what their preferences are in terms of play and interaction, their sensory preferences or sensory profile. And for older adolescents and adults, it's a bit more conversation based. So trying to get their insights, talking a bit about emotions, talking about social relationships and social roles. And again, just creating opportunities to get to know the person a bit better. You would also usually do an in-depth interview with a parent or caregiver, so someone who knows the child or adolescent when they were younger. That's called the ADIOR. That's very widely used in Ireland. And you'd also oftentimes want to try and get a sense about the person's everyday skills. So that's adaptive behavior. And there's a couple of different questionnaires that we use for that. That's really just to try and get a sense of how is the child progressing or developing relative to other children their age. And it's something really important to say that all children will progress and develop and acquire skills at different rates and at different stages. And it can be helpful just to try and get a sense for a particular person, what their kind of profile is like. That can help us to understand the person a little bit better. We might also, if there is the need to do it, we might also look at a learning assessment, so cognitive assessment to understand the person's learning profile, or if there is a query in relation to ADHD, as part of an autism assessment, we might want to get a little bit more information about that. And so a widely used assessment tool is called Conners 4. So that's a questionnaire for parents and school just to get a bit more information. So it's something where you'd also be using a multidisciplinary approach with assessment. So generally, that would be as part of the ADOS session that I mentioned. So that interaction with the person, and oftentimes it's a speech and language therapist who might join that session, but also an occupational therapist might join. And to give you just the simplest kind of explanation, they do an awful lot more than just these things. But SLTs would generally deal with communication. An occupational therapist would deal with what we call kind of small muscles, which is fine motor skills, handwriting, kind of fine motor tasks like zips and buttons and things like that. And also the sensory system that have a good degree of expertise with the sensory system. So you're trying to get, again, perspectives from different clinicians and build up that kind of picture of the person again. It's also important to say that an assessment and a good assessment will be balanced in terms of looking at strengths and needs. So again, as I say, things have developed a lot over time. Things have evolved a lot, and previously reports might have focused a little bit more so on deficits, or a lot more so on deficits or needs. And it's something that we have a bit more, again, a more kind of holistic view of things these days. Again, trying to understand the person and not just in terms of needs. So looking at what does the child do well, what do they enjoy doing, and thinking of some behaviors, not so much in terms of things that are, again, an area of need, but also looking at where they're a positive or a strength for the person as well, not just challenges. And part of that approach is, again, considering things across different settings. So trying to get a sense of the child at home and in the community and at school or preschool, depending on their age. And again, looking at the whole lifespan. So for just earlier kind of development, it's helpful to understand a little bit around typical developmental milestones. This is something that we would often look at as part of psychology assessment. So as I said earlier, all children will develop at different rates, but we have a kind of rough idea of what age certain skills and certain behaviors will start to emerge. Now, if there is a bit of a delay in some of these skills or some of these kind of areas kind of developing, it's not necessarily cause for any kind of concern or query, but it might be something where you would kind of investigate further or want to get a bit more information. So again, this is kind of, we tend to think of it in terms of ranges more so than kind of cutoffs. So generally, again, you're thinking around, particularly helpful thinking around autism would be around kind of when is the child starting to use single words, when are they starting to use phrases, around their interest in interacting with other children. There's a lot more to this, and we'll come back to it in a moment in terms of early childhood. But these are some of the kind of typical milestones that you would expect to see. And again, you might kind of be interested in finding out a little bit more about the child's overall development if there is a bit of a delay with these milestones. Now, some things that will be helpful to kind of think about in terms of, again, recognizing early signs around autism would be around kind of times when there are maybe either changes or transitions, or kind of where there is a bit more of a focus on development. So in working with families, oftentimes, and asking them about their child's early development, they will oftentimes flag the kind of early developmental checks as a time when they were starting to maybe tune into their child's development a little bit more, maybe kind of some things that were pointed out or kind of emerged, or that they were thinking about themselves and going to those checks. So oftentimes parents will start noticing things around that time. But it's really important to say that some signs of autism can be very, very subtle, and subtle. It varies from person to person. So it may not be evident in kind of very early childhood. It may be only later on, or even in hindsight, that some things become more apparent. So other times parents will kind of flag that at around the kind of transition to preschool, that they noticed that maybe there were some differences for their child or some needs for the child that weren't evident when they were a little bit younger. So the kind of elements of that transition that are a little bit different, or again, a child is maybe separating out from their parents for the first time. There might be a change in the kind of routines that they're used to at preschool compared to those at home. The sensory environment might be different. And so there might be things like different smells or different sounds or things like that that might be a little bit unsettling, which isn't the case in the home environment. And also, there's a bit of an expectation that there'll be more interaction with their peers at that stage. So those things can kind of people might kind of tune in a little bit to those elements kind of for their children. Similarly, when starting primary school, that's another bit of a jump, and there can be I suppose one of the things that you'll know kind of from junior infants, senior infants, and first class is kind of greater degree of demand on the child. So for all kids, there's a greater degree of demand on them. So a greater expectation to kind of sit at their desk and listen, and to follow along with instructions and join group activities, and also potentially doing less preferred activities. And that's something that for autistic kids, that could be something where it might be trickier to kind of switch focus to something that they're not as interested in. They might be not as motivated by and want to kind of do the things that they are interested in or that they enjoy. So that could be a little bit tricky, and that can highlight maybe at that stage. And later, still at the kind of transition to secondary school, some parents will start to tune in at this stage. Again, if signs were a lot subtler in early childhood for a particular child, it may be at secondary school that things start to become apparent. So again, some of the big characteristics of this transition are that social rules tend to get a lot more complex. So it's coinciding with adolescence starting as well, which naturally is much more complex time for people. So in terms of social interaction, so social rules get a bit more complex. There's a little bit more onus on the person to kind of take responsibility around managing their own schedule, their own work at school, and work at home as well. There's also the change from, which is a really big one, from primary school to secondary school, in that maybe it's kind of manageable being in one classroom and with the one teacher all through the day, and then switching to having to move classrooms and also having multiple teachers through the day. That could be a little bit overwhelming, a little bit challenging, and so it that can often highlight kind of things for a child at that age. And then another kind of element is that kind of part of adolescence is that people will start to maybe move on from some of the things that they were interested in when they were younger. So kids might move on to different interests, and sometimes that could be a little bit tricky for autistic kids who might be very happy to kind of continue on. Maybe an example here that comes up a little bit would be in relation to things like Lego, where maybe the child might want to really kind of is really still interested in it and wants to kind of share that interest with their friends, but where their friends maybe starting to move on a little bit onto other interests. And that could be quite challenging, and it could be quite a little bit of a confusing time. So adolescence is already a confusing time for most people, but it could be a little bit more so as well. Again, so it's something, I think a really important point is around, again, that things can become more evident or more apparent over time and can be overlooked in childhood because they might be more subtle. But also, you're looking at potential other factors. So, like I said earlier on, what other things might explain behavior or traits or things like that. So, you're looking to see, has a behavior emerged, or a kind of communication style, or has that emerged over time? And some factors that can relate to that might be maybe kind of changes at home. So maybe kind of a house move or changing school. Sometimes bullying can have an impact on a person's kind of presentation, and they might change a little bit in their presentation. Mental health, and also ADHD, which tends to emerge a little bit later than autism. And so generally, in relation to autism, there should be some evidence before the age of 5. And so that's what, again, as psychologists, we try and support families in trying to, in looking back in hindsight, trying to see, was there anything that might have been a characteristic or trait of autism in earlier childhood. So some other things that can be helpful as well. Just oftentimes parents will say that when thinking about their own child and the kind of behaviors that they're seeing, they'll kind of wonder, well, is this something that's typical? Is this something that all kids do? Or is this something that's kind of maybe my own child's personality and they like doing it? Or is there more significance to it? Might there be a sign of something underlying related to it? So again, lots and lots of kids will kind of flap their hands when they're excited when they're toddlers, or they might line things up and play and they might enjoy doing that. But something that's really helpful to think about as parents, if you're kind of thinking about these things, or if you have queries or concerns, is around the kind of quality of the behavior. And I don't mean in terms of kind of high quality, low quality. What I mean more so is just the nature of it. So things to think about in terms of the duration of the behavior, the intensity of the behavior, and the focus of it. So again, given the example there of maybe kind of playing and lining things up, it might be the case that a child would line up toys, or might line up, say, action figures, and then knock them down and enjoy kind of setting them up 2 or 3 times and knocking them down. And then they might move on to another aspect of play. They might go on to play with some cars, or they might go on to stack some blocks or something like that. Whereas for autistic kids, they might their focus and the duration of that play might be a bit longer, might go on more so, and it might be um, again, a good way to thinking about it is that the kind of lining the toys up, or kind of putting them in order, is the kind of main element of the play for an autistic person. So that's the really enjoyable piece. And so it can be the case that the sensory aspects of it and the kind of putting order on the kind of toys can be the element that's really enjoyable, and that's where it kind of comes that repetition of that play and maybe lasting a bit longer. So thinking about those things can be really helpful if you're wondering about certain behaviors, because one of the things that you're looking to try and gauge is a behavior kind of like, is it happening in a little phase? Because all kids will go through little phases of interests in different things, or is it more of a trait? And kind of, are you getting a kind of broader picture that might relate to autism? So something to that we would ask often in an assessment is around how long has a behavior kind of been present for, or a style of interaction, or kind of characteristic of interaction. Would it have been longer than 3 months? And that's kind of, it's an approximation. It wouldn't, oftentimes can range, but that's a really helpful kind of rule of thumb, is around, has that behavior been there for longer than 3 months? Also thinking about the impact of the behavior. So is there any kind of strong impact on your child's life and their ability to kind of to do their everyday things? So would it again impact on attendance at school? Would it impact on, again, to some, for some kids who'd have maybe strong kind of sensory aversions around certain aspects of food, so maybe textures or tastes that might be very overwhelming, that might limit their diet a little bit. And for some kids, in rare cases, that can have a nutritional impact. So you're just kind of looking to see what kind of impact there is there. And also around everyday activities, coming back to kind of talking about adaptive behaviors and skill development. Sometimes, again, it could be the case where a child might be progressing with a number of different skills, so things like toilet training and feeding and things like that. But maybe something like teeth brushing, because there's a sensory element of it, and with autism, there can be kind of amplified kind of sensory responses for a child. So maybe it's the sensory element of teeth brushing. Maybe it's the taste of toothpaste might be very, very strong. Maybe it's the actual the brushing itself is too overwhelming, and so the child might try to avoid or be distressed at kind of doing that activity, where other kind of areas of development are kind of fairly typical for the child. So it's something just to bear in mind and have a little bit of a think about. And again, that idea around intensity and duration, kind of that goes for kind of responses as well. So if a child is becoming very distressed in relation to something that they find overwhelming or unpleasant, a kind of a neurotypical child might kind of calm in a shorter amount of time, so maybe kind of 5 or 10 minutes to calm, whereas an autistic child might need a little bit more time to process their emotions, more time to calm. So that can be helpful as well, thinking about that duration and intensity. So similarly, having a think about, does the behavior have any impact on the families, kind of how you kind of organize the week. So again, would you kind of notice having to adapt maybe kind of any specific routines, or kind of changing routines to kind of adapt things a little bit for your child? Would you have to avoid particular locations? Because again, some families I know I would have worked with, who'd say they have to avoid kind of large crowds or a lot of noise. And so maybe somewhere like Dublin City Centre might be very, very overwhelming for their child. So the other one around kind of I think is well known around kind of supermarkets, which might be kind of playing loud music and be very bright. And so a number of them have kind of adapted their sensory environment to be at certain kind of times of the day or times of the week. So those are just things to think about as well. And also thinking about how many differences or needs you're noticing. So is it just one or two, or is there more than that? Kind of, because again, that's, you're trying to get a sense of, again, traits rather than just kind of one or two things. Usually there will be more than that with autism. So thinking about the very early stages, and so not all of these things will be emerging kind of, this is kind of over the span of 0 to 5 years. So some of these things will emerge a little bit closer to 5, and some of them will emerge a little bit earlier. Oftentimes when we're doing an assessment, we'll focus in particularly on the age 4 to age 5 period, because there's a lot going on developmentally at that stage. And again, there can be kind of transition to preschool, or transition school to primary school at that age. So it's a helpful age to focus in on, and gives us a bit of again, understanding about the child. So I won't talk about everything here and in all but there's just the common kind of thing I've heard about, recognize, and there's more even than this. And again, again, as a psychology assessment, you'll be focusing in and kind of psychology through all these areas with and trying to, but the one that often kind of comes up is in relation to eye contact. And so this again It's not just around a child not using eye contact, or when you're kind of talking to the child that they're not using eye contact and responding or listening. It's about how your child is using eye contact. So thinking about the times that they use eye contact. So things like when they're requesting, or when they're trying to kind of share something with you or show you something, and really kind of looking at how they're using eye contact. So for example, kind of that second point there around kind of joint attention, that is again both when we're trying to interact with child, it's something that we're trying to catch their attention. And then when they're trying to interact with us, they're trying to catch our attention. So it is looking at that kind of joint attention, both response to it and also how they initiate it. So sometimes kids will prefer to do that using just gestures. They might use just kind of the nonverbal ways of doing it. So again, gesture or facial expression, and they may prefer not to use eye contact, or they may find eye contact a bit overwhelming. So you're looking at the kind of context around the use of eye contact. And another piece is around coordination. So some kids will use eye contact, but they won't use or coordinate it with other aspects, because it could be tricky kind of putting the different kind of elements together. So facial expression and speaking and gesture and eye contact all together, there's quite a lot going on with that. And for a neurotypical person, it might be a little bit second nature or innate to kind of put those different pieces together. But for an autistic child, it might be a little bit trickier, a little bit more overwhelming. And so they might have a preference to use a particular way of communicating over others. So thinking about when that's happening and the kind of context around it is really helpful, rather than just does the child use eye contact, yes or no? Because again, a shy person may use eye contact a bit less, and in older kids, again, some of these things will be relevant kind of to older kids as well. Again, in cases like with ADHD, a child might be a bit distractible and might use eye contact a little bit, yes, less, because they're maybe kind of tuning into what's going on around them in the environment as well. Another piece that's really important and which comes up a lot is around language development. And so that's a really helpful thing to understand. And like I said earlier on, it might be the case that a person is kind of hitting their milestones as you'd expect. So within the kind of range that would be kind of typical, but it's about more than that. It's about understanding how are they using their words, and about understanding their kind of tone, their rhythm, their rate of speech, and around what is the kind of context they're using language in. So something that is helpful to understand is around echolalia, which is something that we all do when we're kids. It's something that when you're learning and acquiring language, you'll often repeat sounds and repeat words that you're hearing, which is part of kind of spoken language acquisition. And some autistic kids will tend to use echolalia as a strategy a little bit longer. So they might use it into later kind of years, where a neurotypical child may have ceased using it. So that's that kind of thing of repeating either words or the end of a sentence, or sounds, because in some cases it's a language strategy or it's a communication strategy. It's kind of repeating what you've heard the other person say in kind of response to them, and acknowledging them. And in some cases, it can be because it is an enjoyable thing. There's a sensory element to it, and enjoying kind of saying the phrase. So that leads then to what we call delayed echolalia, or scripted language, or stereotyped language. There's a few different terms that would be used for it. And that again is where maybe an autistic child might be more likely to use kind of certain kind of phrases that they can slot into a conversation. It's maybe where they find the kind of being flexible with language a little bit tricky. And so they might kind of use a phrase. A child that I would have met once, who would have used the phrase kind of "guess what" as a kind of sentence starter, and would use it very frequently. And it's a good strategy. It's a good kind of it's an adaptive strategy, because it's something that will get the kind of conversation going. It doesn't quite always fit into the conversation, and so it's something where it's kind of noticeable, but it's just another way of communicating and another way of kind of getting conversation started. So something where maybe kind of repeating a phrase, and again, there can be a sensory element to that, where someone might like repeating a phrase from a cartoon or a line from a song, and that can be another example of that. Just to talk a little bit about play as well, and mentioned a little bit earlier on about that kind of piece around kind of lining toys up and that kind of element of play, but also just to talk a bit about imaginative play. And again, that's kind of thinking about what kinds of pretend play children are doing. And again, this is kind of maybe moving into a little bit kind of like closer to kind of three, four, five, and what kinds of imaginative play you see, and also kind of how does the child play? So are they happy kind of doing imaginative play on their own? Do they Are they happy for other people to kind of join and to give ideas? Because sometimes again autistic kids might have a little bit more of a kind of strong sense of how they want play to go or what they want to kind of do with their play. So they have a good kind of sense of this is what I'd like to happen. And that could be a kind of calming thing as well, and kind of having a sense of what the outcome will be, and not having the unpredictability with play. So is it the case that the child is kind of happy to let someone else join in and kind of throw in different ideas and kind of respond to that, or does the person prefer to kind of to use their own ideas and stick with the ideas that they've come up with themselves? And that kind of goes for when older. Again, this is at this age, it's kind of more so with parents, and then getting older, kind of you might see, and we'll talk about in a minute. Again with peers as well around kind of play ideas. But also something can be helpful to think of here is again what kind of range of imaginative play is there? Some kids will autistic kids might really like replicating maybe kind of a scene from a TV show or a scene from a film or something like that with their toys. So kind of acting out the scene, and sometimes again that there's it can be really enjoyable kind of sticking to it and doing it as close to as possible with the figures they're kind of acting it out. And again, it's whether that's something that you see very, very frequently. Is it something that you, again, in the context of other kind of varied play? Again, thinking about the context around it and the nature of it again. So I'm going to talk a little bit moving into the next kind of age range. Now, the things that we've spoken about from 0 to 5 are still relevant here. And some of them, again, some of the things that we've spoken about between 0 to 5 can be very, very subtle. Again, I've spoken about things which may be a little bit more overt, but some things can be quite subtle. And so you may only start to see things emerging between kind of 6 to 11 years. So this is kind of examples of things that you may have not picked up on some of the signs between 0 to 5, but maybe starting to pick up on some things at this age. So some of the things that start to emerge between 6 and 11 are around that kind of challenge with making friends or maintaining friendships and kind of keeping friendships going. Or again, sometimes it's the case where a child might be very, very happy to play on their own. And as I say, coming back to having a degree of um, kind of controlling the kind of unpredictability of play. Sometimes that's important for kids that they know what the outcome of the play is going to be. That when I sit down to do a play activity, I have a good idea and a good sense of how it's going to go. And that is something that can be really important for autistic kids. Other times it can be the case where maybe a child might kind of recognize that if other kids are kind of bringing different ideas into play and they're maybe happier to kind of do it in their own way or do it in a particular way, that can be that can lead a little bit to conflict or a little bit to frustration. And so sometimes kids can kind of pick up on that, and they'll know themselves kind of like trying to kind of do this game. I'd like to kind of do it, but I think the other person might disagree or might want to have their own ideas. So I'll do it my own way in that way. So that's something that can be the case, and something that you may notice around. Again, it's thinking around the context with it. And again, some autistic kids are very, very socially motivated and really kind of keen to engage, and other autistic kids might be very, very keen to do things on their own and be that again play in that way. So another thing that you might see at this age is around, I kind of said calling it as you see it, which is really kind of it's thinking about kind of like autistic kids maybe a little bit more confident to kind of say things out and to kind of say what's on their mind and say what they're thinking. And that could be a really nice thing, especially thinking about something like group thinker, where maybe there's a strong personality in a group, and sometimes kids might kind of defer or kind of go with ideas from strong personalities, where again you might see autistic kids might be a little bit more confident to kind of say something out. So if they don't agree with something, or if they're kind of seeing something, and it could be the case sometimes where other people may dance around saying something or not want to say something out. And again, there might be that little bit more confidence for an autistic child to kind of call it as they see it, as say it out. Um, Something else which comes up and which I think is helpful to talk about is masking, and this kind of idea around masking. And parents will often ask me about this during assessments. So It's that kind of idea, and it tends to emerge more so at this age between kind of 6 to 11. So it can be the case that you see it in younger kids, but it is a little bit more likely to emerge kind of in as kids become a bit more self-aware as they get older. And oftentimes with autism, a child might find it a little bit tricky to know exactly what the social rules are in a situation or what's expected in a situation. Sometimes they can pick up on what is expected, and they'll kind of watch what their peers are doing and kind of say, okay, I get the sense in this kind of group, if I do things in a certain way, the other kids are kind of doing it in that way, and I kind of know what I need to do. I'm not quite sure exactly why I need to do it, but I know what I need to do. And that's something which, again, those kind of picking up on kind of social rules or picking up on social mores, it's something that can be a little bit more innate for a neurotypical person. It varies, again, as everything does. It does vary, but it's a little bit more second nature for a neurotypical person. And so if you're having to kind of think through a conversation or think through, okay, what would I be expected to say in this conversation? That's quite mentally taxing. That's quite can be quite exhausting. And so that can sometimes be the case where a child might be really trying to work very, very hard to kind of to do what the other kids are doing. And then when they get home from school, they might be very, very tired or very, very kind of need a lot of time to kind of to recuperate and recharge. And similarly, that's kind of one example on the social side of it, and where that kind of side can be overwhelming. But equally for the kind of sensory side of things, we can see sometimes the sensory environment of school might be quite overwhelming, either again sounds or the visual noise in the classroom or the kind of smells of the classroom, that kind of thing. And if it is kind of overwhelming for a child, it can be the case where they might be aware that they might be feeling upset or feeling a bit distressed environment. They want them to let on their peer feeling upset, which is very kind of for kids to be kind of tuning into that. And same for autistic kids. And so that could be the case when they're kind of getting home from school, that they're kind of letting some of that stress from the day or letting some of that energy out. So sometimes parents will say their child is kind of seems to be getting grand in school, and then when they get home, they're absolutely exhausted and they need longer than would be typical to kind of recuperate because all kids need a bit of time to zonk out or to maybe kind of let out a bit of steam after school. But again, thinking back around the intensity and the duration of behavior or response, for autistic kids, usually it might be the case that they need a little bit longer to recuperate, or there might be a stronger kind of response to kind of stress or letting out that kind of emotion or feeling dysregulated after school. So that's something which I think is a helpful one to kind of to be aware of and why that can happen. So, because again, sometimes parents, again, when talking to them and they're trying to make sense of things a little bit themselves, that it could be a little bit confusing as to why things might seem kind of to be going okay in school, but then to be challenging at home. So that is kind of again just pulling out a few of those areas to talk about, looking at the next kind of age range. And again, some of the things will still be relevant into the teenage years. And harking back to what I was saying, this is kind of coinciding with that transition to secondary school. So there's kind of that can't be kind of overlooked in terms of the impact that it has, and it comes alongside that again increased social complexity, that kind of maybe that kind of greater self awareness, which is a positive thing, and that kind of again kids can often talk a little more about their experiencing maybe even it is overwhelming. They're able to kind of name elements of it at this age, or starting to maybe recognize elements that they find a bit tricky to manage. But it really is that around social complexity, and that really does develop, and it develops quite rapidly in adolescence, and that goes forever. It can be overwhelming again, and that kind of changeover. So sometimes again kids will kind of report themselves feeling a little bit different from peers, and that could be for other aspects aside from autism as well, as I mentioned earlier. And again, as part of an assessment, you'd be trying to tease that out and understand that a little bit more, and getting a sense around the again building up that kind of picture of what things have been like for the person over time. So again, a lot of the things from earlier years will still be relevant now, but they might look a little bit different, and they might again talking about kind of maybe differences in social communication when younger, that will look a little bit different now, but it is still trying to kind of tune those kind of those things over time. Another thing that can come up is around the kind of, again, along with social rules and social complexity increasing at this age, also social communication can increase in complexity. So things can get a little bit more um, covert or a little bit more subtle, again, in terms of how people communicate. So people might be less likely to say, so if you think of younger kids and then teenagers, and younger kids are maybe more likely to say out how they're feeling, or to say, I'm feeling really annoyed, or I'm feeling really, upset, or I'm feeling happy. Whereas teenagers might be a little bit more coy about what they're feeling. And that's kind of something which can be a little bit tricky then for autistic teenagers, kind of picking up on what their peers are feeling and trying to decode and understand what they're kind of trying to communicate. That can be a little bit tricky. And so maybe where they found it a little bit easier with interacting with their peers and understanding their peers' emotions and responses when they were younger, it might be a little bit trickier at the kind of heading into adolescence, and as adolescence kind of moves on. Something else you might see is coming back to that piece around the masking and that kind of response to school maybe being from the sensory side or the social side being a bit more complex, that sometimes at this age you might start seeing kids where previously they were attending primary school and kind of able to manage it quite well, that they might find it a little bit trickier just because, again, there are a lot more demands on teenagers in secondary school compared to younger kids in primary school. So the person may not necessarily, your child may not necessarily be saying that kind of overtly, but that can sometimes be the case. So if a child has been kind of doing really, really again, getting on really well in the school environment, and then moves to a different kind of setup again, where you have multiple teachers in one day, multiple classrooms in one day, lots of different subjects to juggle, and there's a bit more responsibility on the person themselves to try and juggle all that. Um, that can be a bit more overwhelming. So that kind of awareness and that kind of again, the person would be very well aware around it and be able to say it. But also, it might be the case that they're not quite picking up on why it's become a bit more difficult when things were working more so in primary school. And so, something else just to mention around kind of interest, you might see that so spoken too much about interest. So oftentimes autistic kids and adolescents areas of specific interest or very particular interest that they're really, really that are really strong and really deep interest. And you might see that kind of getting a bit more in depth in the kind of adolescent years, so that you might see kind of a great kind of depth of knowledge kind of and again, oftentimes autistic kids love to talk about their interests and really kind of let you know what it is that they're interested in. So you might see that both increasing in terms of the amount of depth and range that within the subject within the area that the person's interest lies, and also about being kind of communicative about it and wanting to talk about it to others. And so just I won't spend too much time on kind of 16 to 18. A lot of the things that we talked about for younger adolescents and younger kids are still relevant between the ages of 16 and 18. I think from talking to Paula, it's something where I think there were fewer people who were joining us tonight who would be who'd have adolescents in this age range. But it still could be helpful just to be aware. Again, I think it's something where you kind of start to hear maybe the person again being a bit more self-aware about what their experiences are like, what it's like for them in terms of their communication, what it's like in terms of the sensory environment, being able to talk a little bit more about it, describe it. So if you're doing an assessment, and something I should say, actually, it goes for 12 to 15 as well, and I neglected to say it, that if you're doing an assessment with adolescents and older adolescents, you'd be hoping to try and get them more involved in the assessment and kind of getting their viewpoint and getting their experiences. So something that's a real positive aspect of doing an assessment with an older person and or an older child or adolescent, that they're able to maybe give a little bit more of their own kind of voice, and you're getting more of their own experience. They're able to kind of describe what their experiences over time have been like. And again, especially where things are a bit more subtle, which is often the case when someone is coming for the first time for an assessment when they're a bit older, it's really helpful to be able to hear that kind of lived experience from the person. And so talking to the young person themselves and being able to get a good sense of what things have been like for them over time, just again getting a sense of what they like in terms of communication, what they don't like, what they like from a sensory side of things, and talking about their interests, that becomes a little bit more possible. And it's something that again as I say, the kind of responsibilities kind of continue to kind of grow as we go through adolescence, and that's something that again. You might hear people kind of reflect back and saying that it might be a little bit daunting or a little bit overwhelming. But again, the purpose of an assessment is try and identify those kind of things and then to be able to kind of get supports for the person afterwards. So it is really helpful to be able to talk through those things and where maybe something does feel a bit daunting, being able to find solutions to that. So just to kind of summarize everything, and again, really important to kind of get that across around that again, all children are different, will all develop at their own pace. And even within autism, again, there's huge variety and huge variety of experiences and different ways of being. So it's something that's really important, that there's no kind of one, again, there's something that we kind of say around if you've met one autistic person, then you met one autistic person. And you really have to kind of individualize things and understand each person as an individual. It's not always possible because for the reasons that I've outlined there, again, oftentimes things can be subtle and you're trying to really kind of tease things out. But if possible, earlier recognition is helpful in terms of understanding and providing intervention and supports. And so if you do have a query or concern, it is really well worthwhile following it up. There's no harm at all in checking things out and asking questions and just teasing it out a little bit. Um, the main piece, I think, again, really important to get across around psychology assessment is that it's all about better understanding your child and what will be helpful for them. So, regardless of the outcome, whether there's a diagnosis or not, or something is recognized or identified or not, it'll always be the case that the idea is to try and understand the person and to be again building up that really complete picture of a person. And again, there'll always be recommendations about support if needed, if there are kind of needs that a person has, even if there isn't a diagnosis of something at the end of it, there'll always be recommendations around support and what'll be helpful. And the last piece I just say is something that I always say to families, and I think it's helpful if there is kind of at the end of the assessment that there's a diagnosis as part of it, or I think it's important regardless of that. It's again, diagnosis is a lens for understanding a person, so it really is just a way of kind of understanding a different perspective on what we're seeing. So it's not a labels limit; it's just a different way of understanding the person. So it can be really helpful in that regard. So thank you very much. That was a very whistle-stop tour. That, again, it's impossible to kind of cover absolutely everything. And hopefully that's kind of picked out some of the key kind of elements and the different stages, which will hopefully be, again, helpful and practical for you in understanding a little bit more around the science of autism.
Oh, and you've been fantastic. Can I just say a really large thank you from myself and all the team at Constellation Healthcare for you giving up your time this evening to deliver such a really informative webinar. To each of you who joined us, you've been brilliant. You've kept the chat hopping and kept me really busy going back and over with a couple of little comments to you. We have run out of time, but I promise we will respond individually to each of your queries. Dr. Rickard will provide a response, and I will follow up with you later this week directly to your email. Our team are on hand at any time. And Owen, if you just flip on to the very
Yeah,
last slide there, perfect. If you want to follow us on our social media pages, you will be kept up to date on our upcoming webinars and updates. If you have specific topics you would like us to research or to speak to you on, please drop them into the chat now. We're always looking to see how best to support you. And most importantly, you're not on your own. If you are navigating neurodiversity and considering if an autism assessment is suitable for your child to support them as they move ahead, we're here to help. Our team are extremely experienced and it's what we're here for. So, just to say a really large thank you to you all for joining us. We hope you enjoyed it and see you next time.
thank you so much, everyone.